news coming in from down south. 7 people have died due to dengue in Tamil Nadu today itself, taking the death toll to 47 as dengue fever is gripping Tamil Nadu. E. Palaniswamy seems to be busy ensuring that he remains in the limelight during distress. The dengue awareness posters and banners displayed all across the state has pictures of him and Jayalalitha nudging there that he's the rightful heir to her. The opposition party DMK has criticized the Chief Minister's move there by stating that this government does not care about people's issues. Shweta joining us now live for more on that. Shweta, this is clearly a case of misplaced priorities there. On one hand, we are seeing the death toll due to dengue rising in the state of Tamil Nadu. On the other hand, E. Palaniswamy not leaving an opportunity to send the message across that he in fact is the rightful heir to Jayalalitha.
Continuingly rising in the state of Tamil Nadu, and today there were 7 deaths that is being reported all across the state, and there are more than 11,744 cases that is being reported, and these are the dengue positive cases. In fact, the main places that are in fact most vulnerable includes Chennai, Tiruvallur, Salem and Tanjavur among the others. In fact, today we are able to see that the Chief Minister is quite being lethargic about the whole issue. In fact, we are able to see the state health department officials and then the government officials are also not in fact involved in this. We are able to see Chief Minister being part of event in Vandalur Zoo where he is naming a tiger, and in fact we are able to see state health department official who is a health minister, Vijay Bhaskar, attending an inaugural event yesterday, and we are able to see that they are not in complete focus and their attention is not towards preventing the Aedes mosquitoes from breeding.
Shweta, on ground, what is it that the government and the Ministry of Health doing there? Because we clearly seeing that the numbers there really adding up. 7 people in a span of a day dying due to dengue there. So on ground, what are the efforts that are being seen?
Yes, when we spoke to the health department officials, they are telling that they are able to provide treatment for most of the patients. In fact, there are thousands and thousands of patients who are lining up in the government hospitals because of this particular problem. And in fact, they are able to provide tertiary services and they are able to admit these patients in different hospitals, in the government hospitals. In fact, that is what here the state health department officials are telling us. In fact, they are going to plan a cleanliness drive for the next 15 days. In fact, the northeast monsoon is nearing, and for this reason, they are planning to in fact bring about this cleanliness drive, and they are also taking measures to in fact ensure that the water is not stagnated in most parts of the cities and suburbs, and these are the precautionary measures that they say they are taking. But however, the opposition parties are criticizing in fact the government, the ruling government, and they are saying that they are not taking enough steps in controlling the Aedes mosquitoes, and that is the reason why it is in fact reached an alarming stage. In fact, remember, the local body elections have also not yet taken place, and for this reason we are able to see the kuvams, the lakes, the rivers, these places are in fact not completely free from environment pollution, and we are able to see that the water is getting stagnated in many areas, and in fact the city does not seem to be rain ready as well.
All right, Shweta, we'll leave it at that. Thanks very much for getting us those inputs. With that, we wrap up this bulletin right here. My colleague Seher joining you on the other side with all the updates.